Age is not really a barrier to hair transplantation. What is a barrier is not knowing the predictable path of hair loss in an individual. So while we, as a global ruling as such, wouldn't operate on anyone particularly young, it's purely because we don't know what way their hair loss is going to go. So we would pretty much hold off on younger patient profiles under the age of about 25, purely because they're still at a very early spectrum in their hair loss. And if you go in and transplant somebody who's at that stage of juvenility, their hair loss is at a point where it could go in any direction and it could suddenly rapidly deteriorate down to the sides. If you come in and transplant a forelock and bring it out on either side, or even transplant a forelock, essentially you could be either committing them to further surgery or making a mess of their hair transplantation, because you end up with a gap between the hair transplant and their native hair that's now suddenly slipped down the side. So we're very cautious with younger patients.
Operating can be detrimental, and it's oftentimes worse than having no surgery at all, the result that they can have. Allowing those patients' hairline to develop and go on medical therapy to hold on to what they have is a better option, rather than intervening too early, which can have much more disastrous long-term effects.